Yo.
What up, though?
I got to talk. I got to tell what I feel. I got to talk about my life as I see it.
All right, then. It's time for you to bring it to the table.
Turn up your radio wherever you at. We about to bring it.
Street Beat.
Yeah.
With Tony B.
For the next hour, Tony B will give you a chance to tackle local, national, and international issues that affect your community.
Street Beat. Street Beat. With Tony.
Welcome to this edition of Street Beat. It's me, Tony B, and we are going to be taking a look at COVID. Yep, that's right. I said COVID. Joining me is going to be Dr. Eric Chow, the Chief of Communicable Disease, Epidemiology, and Immunizations for Public Health Seattle and King County to find out the latest COVID-19 updates as we enter the summer. Yes, we're officially into summer, and Dr. Chow is going to be joining. We're going to talk about everything that you need to know. What's going on with COVID? Yeah, I know that's kind of a bad word. It's behind us, kind of, sort of, but maybe not. We'll find out more from Dr. Chow. I do have a message for you, though. Thank you for listening to us. Rainier Avenue Radio is a people-oriented media outlet dedicated to amplifying the diverse voices of our community, and we are asking you to make a difference and invest in our independent organization so that we can continue to enrich community through programs that you love, like this one. We need your help. We have kicked off a summer campaign to support Rainier Avenue Radio. So from now until August 1st, we're asking you to make a gift in support of our work. Just go to RainierAvenueRadio.world and click on donate to make a gift, and every single gift matters. We are working to raise the resources needed so that we can fund programming. Here's what you can do. We're looking for 12 gifts of $1,000. All right. If you can give $1,000, we're looking for 12 gifts of $1,000. You can scan that QR code as well, and that will take you straight directly to the donate page. We're also looking for 25 gifts of $250. So if you can give $250, help us knock this out. Your collective contributions short support programs like this one, our award-winning coronavirus show, and so much more. Thank you for partnering with us to amplify diverse voices in our community. You will see the direct benefit when you donate to Rainier Avenue Radio. This is our actual first campaign like this. So thank you for listening. Thank you for joining us, and a lot more coming up. But right now, I'm going to tell you what we've got coming up over the summer as well during our summer of festivals. It is summer. And just a second, I'm going to drink some water. Thank you for that water drinking music, Mr. Bellis. We've got a lot going on over the summer. It's the summer of festivals, and we're going to be in our community. Haven't been able to do that for a while because there was this thing called COVID. So I'm going to give you more information on our summer of festivals. But first, I want to get into this, and I'm going to bring Dr. Chow into the broadcast with me. Dr. Chow, how are you doing?
Good afternoon. Thanks so much for having me. I've been really looking forward to this.
Awesome. Well, you heard my little monologue beforehand about COVID. I said it's behind us because that's the way a lot of people feel right now, since we're doing a number of things that we weren't doing during COVID, but it's not really behind us. It hasn't gone away. We've just more effectively learned how to deal with it. Is that the right way to say this, Dr. Chow?
Sure. Yeah, I suppose that's one way to look at it. I think that there are several things that we should probably keep in mind. The big message here is don't let our guard down because COVID is still circulating in our communities, right?
Okay.
But I will say, to speak to your earlier point, is that across a number of different metrics, such as hospitalizations and deaths, I've been encouraged to see that we've seen decreases since the beginning of 2023. But it's also really important for all of us to acknowledge that there are still hospitalizations and deaths that are occurring, particularly among those people who we know who are at higher risk for severe disease, those who are older, 65 years and older, and those people who have underlying health conditions, heart disease, diabetes, immunocompromised states. And I worry about those people because the threat is still very real for them and the families who love them. So,
Okay, so let's kind of do a refresher,
sure.
if you will, just to go back. I know nobody wants to go back, but let's go kind of do a refresher where we were at just quickly a few years ago, a couple 3 years ago, to get to the point that where we are now, so that we just kind of take a review. I'm going to let you do it, but I want to start off with the initial point where Kirkland was considered to be, the Northwest was considered to be the epicenter of this thing called COVID.
Yeah, absolutely. I actually was part of the CDC team that was deployed out here to Seattle, King County to work with our colleagues here in the department that I now work for, and had firsthand experience to see what that was like to see COVID unfold in our communities here in the U.S. Now, that was the first reported case, and those were the first reported cases here in King County. But the reality is that it was likely unfolding across the country at that time. And it was a scary time for all of us, those in public health, and I know for the community as well, because there was much that was unknown. And it was at a time when we really didn't have effective countermeasures. And what I mean by that is vaccines or antivirals or treatments to be able to prevent against severe disease. And it's quite fortunate that we're now we're in a very different place where we have access to those tools that we should continue to use to prevent severe disease in our communities.
Okay, I want to talk about some of the things that have taken place. We have vaccines. There was also and is also an anti-vaccine a movement. The vaccines. Let's talk about where we are at with the vaccines now. That is still a preventative measure. Taking vaccines is something that is, let's start with that.
Absolutely. So we're very fortunate because of the science and all the hard work that people put into developing these vaccines. We have safe and effective vaccines that are available for people across all age groups. Since last September, people may recall that there was a new vaccine that was rolled out. People oftentimes refer to it as the updated bivalent vaccine that covers for the original strain of the COVID-19 virus, as well as the ongoing circulating Omicron variants. And it's really important to acknowledge that that is still available. And if people have not yet received that vaccine, since its release last September, now is the time to get up to date.
And vaccines are available again for everyone at this point. And by everyone, I'm talking about younger children. And you tell me at what age folks should be thinking about getting a vaccine for their young ones.
Absolutely. So vaccines are available for all individuals 6 months and older, and vaccines should be available through a number of different mechanisms, either through our public health resources, and I can provide those resources to you and your listeners, as well as clinics, pharmacies, hospitals. And so now is the time to get up to date. And that's a message that we would like to continue to share.
And the other part about this is there are treatments available if you get COVID, correct?
Absolutely. Another one of those scientific advances during the pandemic has been the availability of those antivirals that help reduce our risk of severe complications. And actually, one of the things that I think is important for people to recognize is sometimes they don't realize that they're at high risk for severe disease, right? Some people don't realize that their heart disease or diabetes may put them at risk, even if they had mild infection initially. And some of these antivirals can be taken early on during their illness course to help reduce that risk. So I've been telling people, patients that I see, people that I speak to, it's probably a good idea to have that conversation with your primary care provider. Are any of those underlying conditions I have considered to put me at greater risk for severe disease? And in which case, it's good to have a game plan. If you do contract COVID or were to get the infection, figure out what your next steps are to then identify, a resource to be able to get access to those antivirals.
My guest again is Dr. Eric Chow. The message is keep your guard up. Don't let our guard down. We're having a conversation about COVID. I just wanted to do a little bit of review here to talk about to create some context for where we were and how we got to where we are today. At this point, is there still a recommendation for folks to take boosters? Can you give us any information on how much of our society, percentage-wise, is vaccinated? And are these messages penetrating through to our communities of color and those who are considered marginalized or most vulnerable to continuing to be getting COVID? I know that's a lot. But.
A lot of excellent questions and things that we're working towards trying to get the message out there about. So first and foremost, vaccines remain the most important measure that all of us can take to prevent ourselves and our loved ones from getting acquiring severe disease due to COVID-19. And so even though we ourselves might not be at risk for severe disease, we certainly engage with or live with people who may be at risk. And so this is the best way for us to be able to protect against that. And yes, to answer your question, it is recommended for all people who are eligible to go ahead and get the vaccines now, and including the updated bivalent booster. And it's likely that we will have an updated formulation of the vaccine available during the respiratory viral season, so around September-ish. We're still waiting to get more details on that. And I will continue to say that COVID-19 throws us curveballs. Previous points when people let their guard down, suddenly a new variant came about, or changes in the epidemiology or how the infection affects people caught us by surprise. So it's best to go ahead and get the vaccine now so that we can protect ourselves and our loved ones from the complications associated with infection.
Okay, so summer. Folks are out. One of the big things, in this previous COVID era was, okay, it's winter. Folks are going to be in. It's summer now. Folks are more likely to be out. We know that this is also an airborne thing. Does summer reduce the risk of getting COVID? And I'm just saying, talking to you in layman terms, folks say, okay, we're saying there's still this thing called COVID. Maybe you don't want to hear about it right now. Maybe you don't want to talk about it right now. We're bringing this up in summer. We'll probably be bringing it up again in the fall when we go back indoors. But just because it's summer, folks are outside, does that reduce the risk of getting COVID?
It's really based off of the activities that we decide to engage in, right? So if summer means that this brings you outside and able to be in a place that has great air circulation, certainly I would perceive those situations to be less, putting you less at risk for infection. However, during the summertime, people also like to travel, right? They're going to be in areas where they're going to be intermingling with people who are coming from all parts of the world, such as airports, which are oftentimes crowded and indoors, and these are public spaces, the same spaces that we know that put people at higher risk for acquiring infection. So I oftentimes tell people, we've learned so much during the COVID-19 pandemic about ways in which we can protect ourselves from COVID and other respiratory viruses. The last thing I want during a vacation is to get an infection. right? Even if it were mild, it just puts it puts a negative light on my experiences. So what are ways in which we can integrate some of those lessons learned, such as wearing a well-fitting, high-quality mask in those scenarios? And we know what those scenarios are. So now applying it to the activities that we're trying to reintegrate into our lives.
And Dr. Chow, what would be, and again, this may be redundant for you, but share with us again, just to make it top of mind, what are some of the signs? Because again, this isn't something now is prevalent in our society, as many cases. And at one point, we were told, "Hey, if you're feeling a certain way, isolate, don't go anywhere, stay at home." Now, maybe it's the flu, maybe it's just a cough, maybe it's allergies. How do we determine some quick ways to say, well, wait a minute, maybe I've contracted COVID?
Great. Thanks so much for this opportunity to review. A lot of those same symptoms that we were concerned about early on during the pandemic are still symptoms that we look out for to either represent COVID or any other respiratory viruses that might be out there. And again, those symptoms oftentimes are respiratory. They can include cough, shortness of breath. We know that congestion can be a part of that, fever, and some people have underlying conditions such as COPD or asthma. And when those are getting exacerbated or worsening from their baseline, you might consider getting tested to figure out whether you qualify for things like antivirals, and also to inform whether you need to stay away from others who might be at risk for severe disease.
And at one point, there were a number of testing locations that were available throughout the city. Has that changed? If someone is suspecting that, you know what, I'm not sure, I'm not feeling well, maybe I have a cough, maybe, but I don't want to infect anybody. What can they do? Where can they go? Again, at one point there was the message out there: just isolate, stay away from everybody. Call, whatever, Seattle Public Health, Seattle King County Public Health. What can we do? Are there sites available for folks to get tested? Yeah.
A lot has changed over the last few months. And unfortunately, with the end of the public health emergency declaration, a lot of those resources that we once had to make testing accessible across our county has really, unfortunately, gone away. And so, but however, we still have resources available for people, and we can provide that information. A lot of that is on our King County website where people can go for testing. Testing continues to be available through traditional pathways such as urgent care clinics, primary care offices, and such. We also have antigen test kits. These are those at-home tests that people have had access to, and those continue to be available through a number of different resources. But yes, if people have questions about where to access these testing resources and what the current state is, we're happy to continue to work with those individuals and communities.
You're listening to Street Beat. It's me, your host, Tony B. And we are talking again about, you know what time it is. We're talking about COVID. This is our award-winning series on COVID and the impacts of the coronavirus on our communities and surrounding communities. And we're having an update. It's been a while since we've had this conversation, and we are engaging in it once again. Dr. Chow says, make sure that you keep your guard up. Dr. Chow, when you say make sure that you keep your guard up, you mentioned these things called antivirals now. Explain to us what an antiviral is and how that is making a difference in where we're at with COVID right now. And again, I just brought up, if you feel like you're getting this thing at one point, it was a death sentence for a lot of folks. Is that still the case, or do we have things now that can help manage COVID if someone does get COVID? There was a stigma attached to COVID, and folks didn't want to say they had it because, again, there was just a lot going on. So antivirals, what is it? Where are we at right now?
So we have a lot more tools in our toolbox nowadays, including these antivirals. And what antivirals are is a type of antibiotic. Basically, it can be a pill, it can be an infusion, it can be something that people take that will reduce their chances of progressing to a more severe form of their disease. In fact, there is a pill called Paxlovid that is recommended for those people who acquire COVID-19 and are at high risk for severe disease. This is why it's important to have a talk with your primary care providers to see whether you would be at risk for severe disease and would otherwise be eligible for this medication, because if taken early, can actually reduce your chances of getting hospitalized and dying. And so that's why it's so important. And then for those people who, despite their best intentions, get COVID-19 and have severe disease, we're in a very different place now, because we actually do have some antivirals that people can take when they're hospitalized to help reduce their chances of death.
Okay. And again, may seem like, in an odd question, is there a cure now for COVID? Is there something that we can take that says, okay, you're protected forever from COVID?
As much as I'd love to say that we had a silver bullet to be able to say that once you take this, you're good for life, unfortunately, that's not how viruses work. They change over time. They are smart. They're able to evade our immune system despite our best efforts, despite our best vaccines and such. And so we constantly have to stay vigilant, stay up to date with the recommended COVID-19 vaccinations, and also be aware of our surroundings, taking steps that we know protect us from the infection during the pandemic, and continuing to integrate that into our daily lives. COVID and other respiratory viruses are not just colds, which is a common mantra that I think people shared before the pandemic. And we know that it can cause severe complications. So what can we do now to be able to integrate some of those lessons learned into our daily activities?
Well, we do know that COVID is not the only virus out there. Dr. Chow, I didn't really talk about what you do. I didn't really ask you about what you do. We just jumped right into this conversation. I do want to back up now and give folks an opportunity to hear why you are the person I am having this conversation with. Chief of Communicable Disease, Epidemiology, and Immunizations. What the heck does that mean?
It's quite a mouthful, and I was considering putting on my tag, but it was actually too long to go across. But thanks for asking that, and I think that this is an important point to clarify. So I have this great opportunity to be able to work with our communicable disease team. So this is a team that oversees notifiable conditions caused by infectious diseases in our community, and we study disease trends in our community and provide guidelines and action points that our community members can take to keep themselves safe from infections, including COVID-19. And then we also have our immunizations team that works on our immunization strategy and to help maximize the uptake of vaccines for vaccine preventable diseases, including COVID-19.
Mm-hmm. And with that in mind, where are we at in the state of Washington? Do you have information? Because we're still hearing a lot of things, about, well, you had states that really locked down and some states that locked down less, and at the same time, we're traveling all over the place again, and folks are in the state of Washington. How many folks have been immunized? Do we have that information? Where are we at health-wise? We knew that our hospitals at one time were overwhelmed. Staff was overwhelmed. Just kind of catch us up with where we're at with COVID today as a state.
So like the rest of the country, I think we're in a very different place now than at other points during the pandemic. We're seeing decreases in hospitalizations and deaths, as I mentioned earlier. But again, those are not reasons to let our guard down at this point, because we know that COVID-19 sends us a curveball sometimes. And so I would say right now, vaccinations at one point during the pandemic in King County has been the highest than any other place in the country. However, our uptake of boosters, which continue to protect us against severe complications associated with the infection, are still pretty low. Only about 30% of our community has received the booster that's been available since last September. So there's still a lot of work that can be done in that front. I would say with regards to hospitalizations and hospitals, our healthcare partners, that's a system that continues to be incredibly fragile. We've had a lot of healthcare worker shortages and beds continue to be short. So any changes or increases to COVID-19 cases can really put additional strain on these resources. And they need to be able to be flexible and nimble enough to be able to adapt to changes and to be able to treat people, not just with COVID-19, but all the other conditions that are out there. So whatever we can do as a community to take steps to reduce that burden in our community, reduce the risks of hospitalizations and death is going to be really important here.
Okay, what I'm about to do, Dr. Chow, is encourage people to go out this summer. There were previous years where I either wasn't doing that because we were locked down, or I was saying these are the precautions that you need to take. I'm not doing that this particular time, and then I'm going to come back to you. All right. But this is our summer of festivals. Everyone's happy about getting out again, happy about having COVID behind us. And so starting on July 29th, we're going to be hosting an Indigenous music fair here at the Columbia City Theater from 11 a.m. until 1 a.m. That's like 12 hours, more than 12 hours, all day long. There'll be bands, there'll be arts, we'll be gathering. It's going to be a lot of fun. On July 5th, we'll be broadcasting live from the Youth Football League Jamboree at Yamoja Fest. Again, sport, getting out, having fun. On August 12th, we'll be broadcasting live from Renton Stadium, inviting you to come out and celebrate with United Way and Doug Baldwin's second annual Back to School Barbecue. Then the very next day, the Othello International Festival returns once again, and we'll be broadcasting live. On October 19th, we're doing something every weekend. The Big Day of Play returns to the Rainier Community Center and Fields. We'll be broadcasting live, and a bunch of fun going on that day. August 28th, once again, we'll be broadcasting live from the MLK Memorial and remembering the 60th anniversary of the March on Washington. Now, Dr. Chow, I shared all these things because we're inviting people to come out. We're inviting people to do what we do, which is socialize, exchange information, support community. I've said all of this. Seems like things are pretty much back to normal. And I'm not asking you to be the wet blanket here and say, no, this is, but what I am going to do at this point after making that announcement is ask you for final words on this conversation that you would like to share with our audience who's listening right now, whether it be commentary on what I just mentioned, something that I have not asked you about, or anything that you want to make sure that you get across to our listeners at this time. Dr. Chow, the floor is yours.
Thank you so much. And first off, let me just say that sounds like a great list of programs and activities. I look forward to participating myself. And I have to be quite honest, I'm looking forward to the summer as well. Travel that I haven't been able to do during the other years during the COVID-19 pandemic. But that doesn't mean that we couldn't do this. We can do this all safely, right? We can make sure that ourselves and our loved ones are up to date with the most up-to-date recommendations for COVID-19 vaccines. We could also integrate some of those practices that I mentioned before about protecting ourselves from infection in indoor public spaces. I always bring with me a well-fitting, high-quality mask, such as a KN95 mask, wherever I go, particularly in airports and airplanes when people might be using in their travels during the summer. When on the 4th of July weekend, most people are probably going to be outside, but once you bring that party indoors, find ways in which you can improve ventilation, such as opening a window where it's safe and keeping a door open. Allow that air circulation to come through and decrease the decrease the concentration of viruses. And then also just stay vigilant. For those people who have any symptoms suggestive of COVID-19, you may not be at risk for severe disease, but other people around you. So it's important to get tested, identify whether you need antivirals, and also to stay away from others who may be at greater risk.
All right. Well, Dr. Chow, thank you for joining us. And we just did an update on COVID. You know, it's but I got to tell you, Dr. Chow, it does feel good to be able to let people know that once again we can attend community events. Once again, we can begin to socialize and share some of the things that make our community special. But the word is be aware, be vigilant. And if you think that you have something and you're coming down with something, get tested. Is that right?
Absolutely. Don't let our guard down.
All right. If something comes up, and I take it that y'all, well, I know this, you can start to determine if you see things in certain communities, right?
Exactly. We have a number of different metrics that we continue to follow over time, and we're always trying to stay vigilant as to what's coming around the corner.
All right. So if that happens, you're going to be back, even if it's midsummer, and we have to have this conversation again. We'll have it and we'll update folks, right?
Yes, absolutely.
Dr. Chow, thanks for joining me here on Street Beat. Appreciate you taking the time to come on and share this information. Maybe not what everybody wanted to talk about right now, but we're having this conversation anyway. Thanks for joining me.
Thank you so much, Tony.
Yep. Wow. Again, you know, be diligent about what's going on. It's me, Tony B. That's our COVID update. Maybe, hopefully, the last one for the summer. But, you know, we will do this again if we need to. That's it. That's all the time I have. That's going to do it for the kid. It's me, Tony B., your host of Street Beat. Black Panthers. Aaron and Elmer, Telling the Truth, will be on again at 7:30 tonight. So check that out, and you can find out more about the history of the Seattle Black Panther Party. Anyway, whether you believe you can or whether you believe you cannot, you are probably right. I'm out. Peace.